Dr. Anthony Harper here, blessed to be with Dr. Carole Lieberman, and thank you, Dr. Lieberman, for joining me. Some very important topics that we're going to be discussing today regarding the mental health issues of presidential candidates. And I had read, and there have been several reports you've been involved with regarding your concerns about President Biden. I wanted to first of all talk with you and get your feedback about your observations for President Biden during the State of the Union address. And I know that I've heard some comments about some might think that he might have been under the influence of some stimulants. What are your concerns? What were your observations of the State of the Union address?
Yes. Well, first of all, I have been warning people about Biden's mental state, notably his cognitive state, since 2020. I was trying to warn people that I called it encroaching dementia. And I was trying to warn them that it was foreseeable, as it has turned out, that he really is not fit for office, that he really does have a lot of signs, symptoms of dementia. And we're seeing it more and more. I mean, now, I noticed it because I work as a forensic psychiatrist and expert witness, and a number of cases that I do have involved the question of competency, whether someone was competent to sign a will, for example. But now you don't really have to be a psychiatrist to see that there is something wrong with him. There are a lot of symptoms. For example, he started out with forgetfulness. That was early on. He had forgetfulness. He also had in 2020, at his campaign stops, he would get angry, as he still does, of course, and as he still does forget things. The memory has gotten worse. But he talked to someone who had asked him a question. He didn't like the question. He said something like, "You're a dog-faced pony soldier." I mean, he was emotionally volatile. And all of this, and so that's another symptom of dementia. And all of these symptoms have grown over the years. And as far as the State of the Union, I think people, on his team, his handlers, his people he works with, have realized that they needed to give him something to help him focus more and help him seem more presidential, more like he actually has a hand, some idea of what's going on in America and in the world, and that he can do something about it. And so, I mean, I do not know for sure. It's my impression, however, that he was on, as he has been before that too, but certainly talking about the State of the Union, the most recent one, it seems like he was on some kind of an amphetamine or another kind of drug, a drug like Adderall, which is an amphetamine, or another kind of drug to help him focus more. Now, those drugs don't cure dementia by any means, don't treat dementia. They're used for ADD or ADHD to help people focus. And when we saw him walk into the room to give the State of the Union, so where he's walking in and he's shaking hands with like everybody and their uncle, and he seems his bumbling self. He seems a little disoriented, a little confused, and slow. And then he makes his way eventually to the podium. And as he's giving the speech, which of course is on teleprompter, but as he's giving it, he gets more and more animated and angry and emotionally volatile. And these are all signs of a medication, a stimulant like an amphetamine.
Okay. I know there are many concerns regarding the presidential debate coming up, but people might also want to know about your opinion about former President Trump. Any concerns that you have about his mental health, and if you could contrast Trump's behavior versus Biden's behavior.
Well, for the sake of transparency, I have long been an ardent Trump supporter. But I think that, people don't really vote for Biden. They vote against Trump. People who don't like Trump they'd vote for whoever was the other candidate. But Trump has undergone, yes, every once in a while he talks right off the cuff, and really quick and so on. And so, yes, every once in a while he'll stumble on something. But when you look at what he's been going through these past months, with all of the lawfare against him, all of the cases, all the days that he has had to sit in court and listen to people say awful things about him, and confront judges who are doing things that are beyond legal, and so it did take a toll on him. I mean, it was very depressing, of course. But even with all of that, he'd come out of the courtroom and do a campaign stop. And so if he, flubs a word or whatever, he's certainly allowed to do that with all of the stress. It's like an inhuman amount of stress that is being put on him. And still he comes out stronger by far than Biden. I mean, the thing that makes Trump so strong and so his message so strong is because he sincerely loves America and sees all the things that are wrong in America that Biden has done to America. It's really Biden. Obama is the puppeteer of Biden. But in any case, Trump sees all that and he wants to fix it. And so that is what is giving him the energy and the stamina and the will to keep on going. And it's not a matter of dementia. There is no question. Trump does not have dementia. There were some people, I guess in 2020, who tried to say, that Trump was a narcissist, a malignant narcissist. And okay, yes, he has a little narcissism in here. I wouldn't say malignant narcissism, but but that's a very far cry from having dementia. You can be a narcissist and still be a great president.
Mm-hmm. Yeah, I know there's a real difference here in the expression of their behavior, and there's other concerns that are coming up about the debate. There's this debate coming up on June 27th. What are your concerns, I guess, overall, coming into the debate? I know that President Biden is supposed to be prepping for this, and of course, President Trump doing that as well. So what are your concerns going into the debate?
Well, I think this is going to be an opportunity for Trump to make it super clear, the difference in the two of them. I don't know. I mean, I was surprised. I still am surprised that Biden agreed to or even made the first step to try to arrange a debate. That is a big mistake, in my opinion, because people are going to see the difference. I mean, yes, granted, he's probably going to have some amphetamines or other kind of stimulant on him. Trump wanted a drug test before the debate, and I don't think that that's happening. At least I haven't heard any further word that was going to happen. So if Biden is on some kind of a stimulant, he'll be able to hold it together to some degree, but nothing like what Trump is going to be able to do. And if Biden had wanted to have it be a seated debate, and at least as of now, that's going to be standing, and it's going to be hard for Biden to stand for that long. Also, they're not allowed to bring notes. And I don't know how, that's something that's going to be hard for Biden. Biden brought notes in the last debate in 2020. So I'm really not sure how he thinks he's going to do all of this. But I think it's going to be a great opportunity for voters to really see the difference between the two.
Regarding a debate, the previous presidential debate, I had noticed when Biden turned his head towards, looking towards Trump, I saw some kind of a gaze that I often see in patients that have dementia. This kind of a stare, this strange gaze. Yes. Any comments that you have about the gaze that people often have with dementia?
Well, he has been showing that a lot. For example, there have been several things in the recent month that have shown Biden, getting more and more demented or more and more ill-equipped to be president, let's say. For example, and even in the State of the Union address, he had that gaze, but also for example, he went to West Point. He was giving the graduation speech at West Point, and they must not have given him just enough stimulant, because he seemed to do sort of okay when he was reading from the teleprompter, but then he sat down and he was supposed to also then shake the hands of the graduates as they walk up to get their diploma. And I don't know whether people didn't tell him that or he forgot or whatever, but somebody went over to him. Someone was sitting next to him and kind of tried to tell him, like, you're up now, you're supposed to be doing this. And he was totally lost. And then even when he was standing there, when he started shaking hands, he still looked like, am I still supposed to be doing this? It was pitiful. Then, of course, on D-Day, when he went to sit down, when you weren't supposed to sit down, then Juneteenth, when he had that stare, in the middle, people were dancing around him and he was just frozen in a stare. And then at the LA Foundation, there was a fundraiser, and he was, he did his usual thing at the end of an event, like at the end of one of his speeches or at the end when he's on the podium and it's supposed to end, he doesn't have a clue how to get off. And so Obama had to put his arm around Biden's shoulders and took him off the stage. And that's because the Easter Bunny wasn't available that night. So Obama had to do it. But I mean, it's funny, but it's really tragic. I mean, first of all, I'm not making fun of Biden with his health problems, but he should be, it's his own fault for still wanting to run, still not really caring about America. If he loved America, there is no way he would run again. He would have to realize that he's losing it and that he's not in the tip-top shape that a president of the United States needs to be in, and he would voluntarily not run.
Okay, for his family and others that prop him up, is it considered elder abuse for them to portray him as fit and ready for office? And I think especially the White House physician saying that President Biden is well enough to run for another 4 years. Is that a concern that you might have, that elder abuse is happening?
Well, for the physicians, I think that they should have their license taken away. They're lying. They're simply lying. And, a doctor shouldn't, no matter whether you're the doctor of the president or whoever, you shouldn't be lying. And yet, they try to pretend that he's just fine, but if you look into some of the things that they're saying, you can see that they're just trying to cover stuff up. Like, for example, sleep apnea. This time they did mention that he had sleep apnea, but then they also said that they finally found a mask, the mask that you wear if you have sleep apnea to wear at night and so on, so you can breathe better. We finally found a mask that fits better, a CPAP that fits better around his face. And so that's going to be much better. Well, so what does that mean? For years, he didn't have a CPAP that fit him well, which means that there was less oxygen getting to his brain for all those years. So, and then there's all kinds of it's just totally, of course you want to be the physician to the president of the United States, but there comes a point when ethics should intervene. Now, as far as elder abuse, particularly his wife should be ashamed of herself, but she doesn't even, the bottom line is she likes being first lady more than she loves her husband. Because if you loved your husband or your wife or your mother or your father, anybody who had these symptoms, you wouldn't keep pushing them to do this job, this stressful job, and making a fool of themselves also, with all these different things that they do that he does at these events. You would get him off to a doctor.
Mm-hmm. Yeah, these are very serious concerns. And I think You were talking about the White House position, and it really, I consider you that might be bordering on unethical for the part of the White House position to say that he's really not having some problem here. And what would your response to be the previous White House position, Dr. Ronnie Jackson, who's a member of Congress, and other congressmen that are demanding a cognitive test? Because President Trump, he submitted to a cognitive test and passed, but yet the White House position and President Biden, they're refusing this cognitive test in response to that issue.
Yes. Well, first of all, I actually, in the publication, The American Greatness, I had an open letter to Biden published in which I explained to him why he needed a cognitive exam and offered to give him one myself. And needless to say, the phone has not rung, and I'm not holding my breath. But yes, of course, he needs a cognitive exam. There's no way that he would pass. For example, it's not an intelligence test. It's just tests different parts of the brain. And one of the questions on the test is, who's the president of the United States? And he never remembers that. He says that it's Kamala Harris or his wife or various people. Lots of times he's forgotten that he's the president. So there's no way he would pass the test.
Okay, along with this, also I think one might be concerns for, I don't know if you can comment about Parkinson's issues, because I know the dementia sometimes can be a component of Parkinson's. I have witnessed, as a White House correspondent, his tremors. One time I saw him violently shaking his right arm. Have you observed tremors on the part of President Biden, and any concerns that about that issue, along with the physical gait of him walking across the White House lawn and other places?
Yes, well, his doctor has said that the gait is due to some kind of a neuropathy or something in his feet. He tried to connect. I mean, maybe he does have a neuropathy, but which I guess could be a way of disguising really saying Parkinson's. Parkinson's is more of a motor kind of disorder. You can also be demented in Parkinson's, but you don't have to be. It's primarily with the trembling and the shuffling gait, and so as opposed to things that are more cognitive. So that's why I'm focused. It's possible that he has Parkinson's also, but I focus more on the dementia and what type of dementia. I think the most likely type of dementia, well, the most common dementia in general in people is Alzheimer's. But I think that Biden, and again, I've never examined Biden myself, but I think that Biden may well have a vascular dementia, because he has had lots of cardiovascular problems. He had a brain bleed, an aneurysm that became a brain bleed years ago, and he has atrial fibrillation, which is an irregular heartbeat, and the side effect of that, or something that often happens with that, is transient ischemic attacks, strokes. And so I would say that it's most likely that. But it really kind of doesn't. I mean, this is why he needs to be seen by a neurologist, a psychiatrist or a psychologist to do the testing, but we know he's not going to pass that. And then a neurologist to look into the causes of dementia and find out what he has and then treat him.
Mm-hmm. So what are your final concerns going into this presidential debate, and for the future for President Biden's thinking that he can run for another 4 years?
Well, it doesn't have anything to do with age per se. People are saying, oh, he's the oldest president. My mother lived to 101 and a half, and she was, she could have run rings around Biden. She was perfectly fine, perfectly lucid and intelligent and so on at the very end. So it's not about the age per se. Granted, the older you get, the more likely it is that you're going to have various physical problems. But just to kind of look at his specific physical cognitive problems, the reason why I started warning people in 2020 was because I saw that it was so foreseeable that it was going to go downhill. I mean, that's what happens with any kind of a dementia. I said he had encroaching dementia, in other words, the beginning of it, but it's foreseeable that then it gets worse and worse. And that's what's been happening. Now, Obama loves it that Biden does not have all his faculties, because that makes it easier for Obama to be the puppeteer. But our country can't survive 4 more years of Biden. I mean, it's just plain and simple. We are in so much trouble. First of all, his surrender in Afghanistan, that is what made, everyone around the world, all the leaders could see from that move, from what happened, the devastation that happened. They could see that he didn't have all of his marbles. And that is what got all of our enemies to start thinking, aha, America is weak now. We can do whatever we want. And that's when Putin invaded Ukraine. And that's when China started acting up, and Iran, all our enemies. And now, of course, things have gotten a lot worse with all the different things happening in America. We have terrorists coming across the borders, terrorists on the terrorist watch list, no less the ones that they didn't catch and see whether they were on the watch list. We have 80,000 Afghans who weren't vetted, who are in America. I mean, things are going to start erupting, not to mention, of course, all the outside. China is sending in people through our borders. I mean, everybody's coming in. And then Russia had a submarine just recently go near Cuba, go near our southern border. The East Coast, the Atlantic. So there are so many problems. The economy, of course, so many problems. And Biden, he doesn't have, with dementia, it's not just about forgetting things. It's also one of the most sophisticated parts of the brain is where you can have abstract thinking, the kind that good chess players have, where you can keep in your mind different solutions, different strategies, and consider one over the other, and think about all these things and then pick your course. Well, he doesn't have that. He can't hold all of these different problems in his head at the same time, or even just one problem with the different possibilities of fixing it. And so our country I really don't believe our country can survive another 4 years of Biden.
I know a lot of people have concerns about this, about whether America can survive on many levels. There's so much at risk. I want people to learn more information about what you have to offer. I know you have a couple websites. People can see your books. They can get your books. What websites you would like to promote for you, and some book titles?
Sure. Well, one of my websites is Expert Witness Forensic Psychiatrist.com, and that was where it talks about the things that I do in criminal and civil cases, and that's where I was talking about being an expert witness and how I recognize Biden's signs of encroaching dementia. Then my other website, another website, is terroristtherapist.com. Since 9/11, I have been helping people cope with terrorism. I've written 2 books on terrorism. My latest one is Lions and Tigers and Terrorists, Oh My, How to Protect Your Child in a Time of Terror. And when people buy that from my website, I donate the proceeds to Israel. What else? Also, I do a podcast called The Terrorist Therapist Show. I've been working on that, helping people with terrorism, or trying to not just helping people cope with terrorism, but trying to warn people since 9/11 about the fact that terrorists aren't done. Their goal is Israel, of course, is first. Israel is the canary in the coal mine. And yes, they want to go against Jews and Israel and to destroy Israel. That's their number 1 and number 2 targets, that they teach their little kids in the madrasas. But they don't want to stop at that. It's global jihad that their religion tells them to create, that they'll be rewarded the most, they'll be martyrs. And so we are all in danger. These students who are protesting and so on, pro-Hamas, pro-Palestine. Really, it's anti-Jew and anti-America. But in any case, if there was a terrorist walking onto the campus, they'd be dead, especially the queers for Palestine. Terrorists do not support LGBTQ+. So these people are it's so frustrating to me that people are so ignorant about what terrorism really is and what their goals are. And they just want to kill the unbelievers. Anybody who doesn't believe in radical Islam, they are unbelievers and they are to be destroyed. And those who remain are to be put under Sharia law. So we're like, people are so blind here. It's just very scary.
So how would you contrast President Biden to President Trump regarding the college press protests and what they've dealt with, their policies in handling these, I would say, terrorists on college campuses and so forth?
Well, Biden just cares about being elected. And so he's been trying to walk a fine line between being, supporting Israel, our ally, and making the students or the terrorists here happy, people in the pro-Palestinian people and so on happy, that he's on their side. And so it's kind of been a mess. And of course, Obama is very much anti-Semitic and anti-Israel, and that's leading a lot of this. But, Trump, of course, we know that Trump was very pro-Israel. He's been the most pro-Israel president that we've ever had. He made he brought the consulate or the embassy, into Jerusalem and so on. And it's just so many, the Abraham Accord, he's done so much. And we wouldn't have this mess in the Middle East right now if Trump had been president.
It is a very troubling time on many levels. I actually was at the U.S. Embassy opening ceremony in Jerusalem with Mark Levin and his wife there. But I do see the contrast, as you do, between President Biden and President Trump and their support of Israel. And I thank you, Dr. Lieberman, for joining me to share these important insights on these matters. And once again, your website again?
terroristtherapist.com and expert witness forensic psychiatrist.com.
Thank you, Dr. Lieberman, for joining me today.
Thank you.